Sir. So, today I am going to present to you the health teaching plan I made. So, the disease that we are gonna be talking about is malaria. So, the objectives for this presentation is to provide information about health, to take precautionary and preventive measures against communicable diseases, and to develop sense of value in health. So the content outline for this presentation is we are gonna tackle about the malaria, about the disease, which is malaria, the pathophysiology of the malaria, the signs and symptoms, and medical treatment for this disease. So what is malaria all about? So malaria is a potentially lethal disease caused by a parasite that infects a specific type of mosquito that feeds on humans. So it is found primarily in tropical nations since um, mosquitoes typically go for tropical countries or tropical um, setting. So, although malaria is preventable and curable, the severity of the illness is primarily determined by the infected person's immune state. So, partial immunity develops over time as a result of repeated infection, and immunity is typically short lived in the absence of recurrent infection. The pathophysiology of malaria. Malaria is caused by the infection of red blood cells by the asexual forms of the malaria parasite. So, the involvement of red cells makes malaria a potentially multi-system disease because the blood reaches every organ of the body. Although Plasmodium falciparum infection is more commonly associated with severe malaria, complications and even deaths have been observed in cases of non-falciparum malaria as well. So, Plasmodium falciparum is a unicellular protozoan parasite of humans and the deadliest species of Plasmodium that causes malaria in humans. So, infection of red blood cells by malaria parasites, particularly P. falciparum, results in gradual and severe structural, biochemical, and mechanical changes that can deteriorate into life threatening malaria sequelae. While P. falciparum infection causes the great majority of severe malaria and concomitant mortality, problems can arise non falciparum infections as well. Okay, so before we proceed to the signs and symptoms and medical treatment of malaria, we are going to have a break and do an icebreaker. So this icebreaker is called Guess That Drawing. So I'm going to show pictures and you're going to guess it, friends. Okay. Okay, so here is the first picture. What is in the picture? So I'm gonna count to three and then you will going uh, to say or to show your answer. Three, two, one, go. Okay, so the thing in the picture is a mosquito. So then next, three, two, one, go. Okay, so what the drawing on the screen is a person who is having a fever. Okay, next is three, two, one. Okay, so the person in the screen that you can see is being nauseous or having a nausea. So these pictures are the drawings, the illustrations that you have seen earlier is the signs and symptoms of malaria. So, fever, chills, sweating, headache, and nausea, paroxysm, the intermittent bouts of chills and fever. Falciparum malaria can cause cough, diarrhea, respiratory disease, shock, renal and liver failure, pulmonary and cerebral edema, coma, and death. So, those are the signs and symptoms of malaria. Also, malaria may cause anemia and jaundice or the yellow coloring of the skin and eyes because of the loss of red blood cells. So, as I have mentioned earlier, malaria is a preventable and curable disease. So this is the medical treatments for malaria. So the first anti-malarial for interim oral treatment. So this treatment or these drugs that I am going to mention is you can take it orally. So artemether-lumefantrine, antovacone, proguanil, quinine, and mefloquine. So Cortem or artemether-lumefantrine is the preferred follow-on treatment because of its fast onset of action, but adequate alternatives are atovaquone, proguanil or the malarone, and quinine plus doxycycline or clindamycin or mefloquine. So, because of a risk of severe neuropsychiatric adverse events at treatment doses, mefloquine should only be used if other options are not available. So, if the patient received oral treatment prior to receiving IV artesunate, the same medication can be used as follow-on treatment, but a full regimen is required. As for any malaria treatment, the regimen selection should not include the medication used for chemoprophylaxis. So when the IV artesunate arrives, discontinue the oral medication and begin parenteral treatment. So, mano siyang i-inject. Then, each IV artesunate dose is 2.4 milligram per kilogram, and IV artesunate dose should be administered at 0, 12, and 24 hours. So, IV artesunate can be used in infants, children, and pregnant women. Given that severe malaria is especially life-threatening for pregnant women and their fetuses, and the lack of other treatment options for severe malaria in the United States, the benefits of treatment with IV artesunate outweighs the risks, and IV artesunate should not be withheld. The only formal contraindication to IV artesunate treatment is known allergy to IV artemisinins. Okay, so time for the short quiz. The first question is to give at least 3 signs and symptoms of malaria. The second question is true or false. The disease malaria is preventable and curable. So is it true or false? Then the third one is also true or false. Malaria is caused by the infection of red blood cells. Number 4 is headache and nausea a sign and symptom of malaria. True or false? Then last, give one anti-malarial for interim oral treatment. Okay, so that would be all. Thank you for listening, sir, and God bless us all.